Masks have been in human history for over 9,000 years. Some studies said they may exist for around 30 to 40,000 years, with many purposes such as art performing, spirit rituals, hiding identity, or protecting our health. But do you really know when and how the medical mask is famous and started becoming a much-to-have item in the last few years came to our life and how it could protect ourselves from tiny deadly viruses? Let's check it out with today's video. The earliest form of medical mask started around 2,000 years ago. Way too young compared to other forms of masks. The first form of the medical mask was made by the Roman philosopher Pliny the Elder, who used animal blood or skins, of course after cleaning, as masks to filter dust while crushing toxic minerals for pigmentation and decoration, such as mercuric sulfide or cinnabar. While at the same time, on the other side of the continent, the Chinese only have habits of covering their noses and mouths from dust by the sleeve of their hanfu for 1,000 years. But when the explorer Marco Polo came and visited China during the early 14th century, he had described the servants attending to the Chinese emperor and his entourage wearing silk scarves on their face to prevent their breath from contaminating the food when served. The first official invention of the medical mask happened during the early 17th century, as the Black Death haunted Europe for a few last centuries and caused the most fatal pandemic ever in human history. This time, beak masks, as later became the symbol of the plague, had been invented by French doctor Charles de Lorme. It could cover the entire face of the wearer, with glass portals to see and the beak to be filled with spices and aromatics, like mint and camphor, to help fill out the disease. In the 15th century, artist Leonardo da Vinci had soaked a cloth in water and placed it on his face to prevent toxic chemicals from paint and plaster from entering his lungs. This method is still recommended to people trying to escape from the burning building, which helps people protect their lungs from smoke inhalation. In 1861, the discovery of the presence of bacteria in the air by scientist Louis Pasteur made people aware of the dangers of breathing in harmful pathogens. This led doctors to start using cotton masks to limit contagion during epidemics. It's also popular for women to wear lace veils to protect their lungs from harmful airborne particles. The prototype of today's medical masks was invented by a public health specialist from Malaya, Walinda, who was investigating a pneumonic plague in northern China. His mask was made from layers of gauze enveloped in cotton, with ties so that it could be hung on the ears. It became a symbol for people wearing masks during pandemics such as the 1918 flu. In the early 20th century, doctors and nurses were recommended to wear masks during surgery, as a study published about the streptococci bacteria expelled when scarlet fever patients coughed or cried. In the recent study by Health Affairs, which compared the COVID-19 growth rate before and after mask mandates in 15 states and the District of Columbia, found that in the first 5 days after a mandate, the daily growth rate slowed by 0.9 percentage points compared to the 5 days before the mandate. At 3 weeks, the daily growth rate had slowed by 2 percentage points. Also, a study from ResearchGate looked at COVID-19 deaths over 198 countries and found that those with cultural or government policies favoring mask wearing had lower death rates. In this video, we can see wearing masks correctly could help prevent the breath of the wearer to open air, therefore help prevent possibly contagious diseases. So, whether you like it or not, wearing a mask might not help you prevent 100% from coronavirus, but it is better to have one more thing by your side to protect yourself than nothing. Your life and people around you are worth more than a little uncomfortable, right? Which topic do you want us to do next? Comment and subscribe to us for more content in the future.